Hello and welcome to episode 17 of the Auditing Antics podcast. So today I have a good friend of mine, Sean Weiss, joining me. And, Sean, I don't think that you need too much of a introduction here. Every time I say your name, everybody always goes, "Oh yeah, the compliance guy." So, you're very well known.
Well, it's
And
better than saying something else.
well, we could think of other things, but we won't say
Yes,
those.
there are other adjectives and verbs that I'm sure people would like to use for me, but we'll just say infamous. How's that?
Yes, there we go. All right, so I'm excited for our topic today. Sean and I have been talking back and forth recently. We both have different situations and clients where we've had basically AI companies or developers approaching us to help. They've brought their products to a certain level. They're looking now at the landscape of the industry. They're very heavy on the tech side. They don't understand everything as it pertains to what we do with reimbursement and how to get that money or how to sell the product to somebody so it looks valuable as an ad. And, for me, there's a lot of brick walls that are being hit, and I think there's a lot of disappointed developers. But, I wanted to break this down from the compliance side because, Sean, I've also been hearing from different organizations that have, for example, Epic or NextGen or eClinicalWorks, and they have AI products being integrated through the vendor. And I have some that are saying, don't touch it because we don't know what it does. And there's concern there as well. So what are your thoughts initially on the side related to the developers and what we're seeing right now when they're trying to start to market the product?
Yeah, listen. So hey, as you know, I'm a fan of your show. I have to be,
Yes.
right? I don't
Yes,
have to be.
yes,
I don't
you
have to be, but I am. There's no doubt about it. I think
Thank you.
first and foremost, I think you've done an incredible job, and it's so fun to get to be a guest on somebody's podcast as opposed to me always having to be the one trying to, solicit information and elicit conversations and things like that. But look, I stand by what I've said all along regarding artificial intelligence in healthcare. You have to segment it, right? I think where AI exists right now in the clinical aspect is far more advanced and far more accepted than where it is on the operational side. Artificial intelligence is a tool, period. It requires human interaction on both the front end and the back end. And without it, you wind up finding yourself getting into situations where you're relying on machine learning to be able to provide you with information, sourced documents, citations, things along that line. And there's a term that everybody needs to become aware of when it comes to artificial intelligence, and it's referred to hallucinations, right? And I'm not talking about what people did in the 70s. I'm talking about artificial intelligence hallucinations, which basically refers to when an AI model produces incorrect or misleading information that often appears confident even when it lacks factual accuracy, right? These errors typically arise from insufficient or biased training data, misunderstandings of complex prompts, or the AI's inherent limitations in reasoning and understanding. So what a lot of the guys and gals that I'm working with right now on AI, in order for them to address and mitigate these AI hallucinations, developers are trying to find ways that they can improve their training data quality as far as like implementing strong validation and error checks and the ability to use feedback from the users for ongoing model refinement. And we can talk more about hallucinations. But to your point, Stephanie, regarding NextGen or Athena or Epic. Every one of them has an element of AI built into it, whether it's next gen using what's called ambient dictation. Epic has their own ambient voice. Athena has ambient transcription. The problem is it still requires a review from the physician or the non-physician practitioner to ensure that what was captured during an encounter between themselves and a patient is accurately captured and translated into a progress note, if you will. But as far as the ability to select the right CPT codes, I've had one group tell me ours has a 99.9% accuracy rate. I've yet to see it.
Yeah.
And I'm just being candid. I think AI is on the rise. There's been a huge feud, as everybody knows, but as fast as it happened, it's already over between the president and Elon Musk. I will tell you, for me, and the reason why I bring up Elon Musk is because I will tell you, I am using AI more than I ever have in the past, and that's because I'm being consulted by AI companies. I still think my brain is what I need to use in the books and the research that I do, but AI definitely speeds things up. But I will tell you, XAI is built on American chips, it's built on American hardware, and it's built by an American company. The hallucination rates are absolutely mind-boggling how low the hallucination rates are. And I will tell you the comprehensive nature of what you get from XAI versus even Chat GPT or the other one that's out there now. You see it all over Facebook.
I'm bad at that
Something.
stuff. Well, they have like Gemini with Google, and Meta has their own, and things like that.
Grok, GROCK, I think it's called Grok,
Okay.
or GROK, something like that. But the point is, yes, right now, and I'm not going to. I hate using this term. Right now, everybody's talking about AI because it's the sexy word. It's the word of now. I don't know if it's sexy, but I mean it's the word of now. And for me, I look at it and I'm old school. So I say, listen, until we have a level of confidence in what's being produced where the hallucinations are in the single digits, or, I don't think they're ever going to eliminate them, but I think they'll get them down to the single digits. I just think AI is an evolving technology, and it's going to take a good period of time to get us in the healthcare industry to where we need to be. And I will tell you, don't think for a moment that providers relying on AI for documentation that fails to substantiate the services that were provided, or to rely on AI for the selection of diagnosis codes, HCPCS codes, CPT codes, the use of modifiers, that you're going to be able to escape an allegation of healthcare fraud, or more likely a complaint under the False Claims Act. I think providers have to be aware of that, because there's an inherent and significant risk with using AI right now.
Well, and Sean, that's a good point, because actually this morning on LinkedIn, Stacy Buck, she's amazing in the industry. She does a lot of radiology, interventional radiology, cardiovascular, all of that. Pretty much those things that I tend to shy away from. That's the one specialty I shy away from.
Yeah.
She's amazing at.
She is. She's incredible.
But she had a really interesting post this morning related to AI in radiology. And there's a company out there that has created AI products that are really helping from a workflow perspective. From a provider perspective, they're looking at things like work-life balance, different things like that. And, one of the things that worried me about it when I read it, number one, love the product. It looks amazing. But to your point, what you were saying with the risk and the legal implications, on the site, they're saying that it is a 1099, so it's a contract for providers. They can quickly log in. All of the stuff is there and organized for them and prioritized or whatever. And they kept using words like you can do this anywhere. So Sean, the first thing I think about is, okay, how many providers do we have that are constantly traveling overseas? So then they would technically be providing an interpretation outside of the US borders. You can't do that and bill the insurance for that. The
100%.
other thing I'm wondering is, do the providers know their obligations? I also saw an article yesterday, and I forget what the specialty was, but the provider in the article was going on and on about how great telehealth is now because she's visited 22 beaches in the past year. Okay, well, are you licensed in all of those states that you're traveling to? Do you know that that's a problem? And, coming out of the telehealth time, I've seen different articles and even different people posting on LinkedIn about, APP practitioners, some even sitting in jail right now because they were a part of schemes and they didn't realize what they were doing.
Yeah.
So I have a concern there that we have good products. That particular company has a way to receive reimbursement for what they're doing, but does that 1099 provider know the risks they're taking on? I'm sure that company doesn't know about all of this or
Yeah,
isn't putting it out there.
I agree with you. And I think the thing to keep in mind is, listen, the majority of these companies right now, especially those that are becoming more successful in the artificial intelligence space, have backing or are owned by private equity, right?
Right.
So PE money,
100%.
right? So
100%.
PE money is driving the AI industry right now. And as you and I know, there's a lot of PE getting into the healthcare space because we're a $3 trillion industry. And they buy a couple of, maybe they buy one or two healthcare, organizations, and they think automatically, well, we're in the healthcare space, but they don't understand that healthcare is a 27-headed monster when it comes to the regulations, the laws. So let's put some of this into context, right? Because to your point, a PE company only knows what they know, and what they don't know, they're not going to be able to rightfully educate a provider who's a 1099 that they're trying to get work with them or get to work with them. So let's put some context to this. So there are several state attorneys general across the country who have actually taken legal action or issued guidance related to AI companies that are focusing on a variety of concerns. So we could start with the state of Texas. Ken Paxton, who's the attorney general in the state of Texas, took action against, if you remember, a company called Pieces. And he got a settlement from them for deceptive marketing claims about its product's accuracy. Again, we're talking about accuracy of collecting information versus providers who are traveling to different states or utilizing services outside of the United States to be able to render medical services to a patient and then seek U.S. remuneration for those. You can't do that. Services rendered must be rendered in the United States in order to be eligible for reimbursement from the federal payer program. It's that simple. But, let's look at a couple of these other ones because, when we talk about Pieces, right, what actually happened was the company put the public at risk by making false claims about the safety and accuracies of its generative AI products. So while it was capturing information, it was hallucinating and it wasn't capturing information as was discussed between the provider and the patient during the encounter. You could look at the state of California. Rob Bonta, I think, is the AG in the state, right? He's been extremely active with going after a lot of these companies. Anything that, if you have an AI tool that misleads customers, it denies access to service, it causes what refers to as discriminatory outcomes. And remember, discriminatory, I'm making up my own words now. Discriminatory isn't talking about the color of somebody's skin. It's talking about how it's taking certain populations and it's and it's weighing something heavier towards one side versus the other, which creates the discrimination or the discriminatory outcomes. In California, you have the unfair competition law and civil rights act that's being utilized right now to go after AI companies. Go back to Texas. Texas settled with Meta, Facebook, for $1.4 billion for violating biometric privacy rights, and with Google for another $1.4 billion for data privacy violations related to biometric and location data. The Northeast, it's not just the big states like Texas and California. You go look at Massachusetts. Joy Campbell issued formal guidance warning that companies could violate the Massachusetts Consumer Protection Act through misrepresenting the reliability of AI systems or falsely advertising their quality. Vermont, another state that has clear laws. Colorado, Washington. I mean, we could go on and on and on and on. The point is, and I'm not trying to poo-poo on any AI companies because I'm being consulted by them, but they also know that I'm very transparent. I'm very open and honest about my thoughts on AI right now. And there's good, there's bad, and there's ugly. And it's going to take people like yourself, Stephanie, Stacy Buck, and others who are recognized industry leaders in their respective areas who have the ability to look at something and say, here's why this is problematic.
Yes.
Here's what can be done to mitigate the risk of further hallucinations or for providing, information that is discriminatory. So it's going to be an evolution. I personally believe we're probably looking at another 3 to 5 years before we're really starting to get comfortable with AI at a very high level. I mean, it exists now. It's rising up. I think we're still 3 to 5 years away from us being more comfortable with using it. But again, what does that mean for you? I'm a lot older than you. So, AI replacing me in the next 5 years, I'll probably be out of the industry. Who knows? I'm one of the gray hair OGs. So
we'll just clone you somehow.
I think there's going to be a lot of people, especially some prosecutors like the one last week, who can't wait for me to get out of the industry, but we'll leave that for another day.
Well, and Sean, I'm working with a company right now, and I'm not going to go into too much detail because, when they're building different things, obviously they want their confidentiality for their product and all of that. But I'm working with an organization, and they're at the point where they have a physician consultant involved. They're going through their own clinical trials to test the system to what you were speaking to. But they come to me because now they're getting close to going in front of PE firms. They're wanting that money to back their development.
Yeah.
And they're looking forward to, okay, how are we going to sell this? So one of the first questions that I always have when I'm working with an AI company is, who is your target customer? And the reason for that is we need to know who it is that they think they're going to be obtaining their monies from, to know if that particular entity has an option to bill for the service, and that entire rabbit hole that we end up going down. And what's happening right now, the organization I'm working with, they're having this realization. So it's in, what I'll say is that it's in the space of pharmacy services. And, if we think about pharmacy, the first thing that comes to my mind is, okay, we don't have a lot of options to bill for the work of a pharmacist, right? We had a little bit of a door open during the PHE with some of the stuff that came about then, but there's not a lot that can be billed for. And in this particular situation, the developer was thinking, okay, well, they found 3 CPT codes that are specific to a pharmacist. And they say, okay, what about these? They're not thinking about the fact that not all payers are going to reimburse it. Some of the codes that are, have that structure are on average only around 25 per code or per unit. And then you think about the work involved to even support the CPT code, what that would mean for the practices. And, it's not really becoming a viable option. And one of the things that I was actually digging through this morning, I was on a call right before this, was when we're looking at these pharmacy services, the particular code set they wanted to use is statutorily excluded by CMS. They thought in their mind that Medicare was going to be a large population that could use this particular tool and service. So they were looking to that as their main service line, as far as providers and all of that. So the conversation shifts, because now we're talking about the fact, okay, you can't go directly to Medicare for the monies. There are parts of Medicare Advantage plans, so their agreement with the government or a prescription-based insurance plan, they have to have sponsors that are monitoring what's happening in the pharmacies. That's an option, but it's a cost. So from a sales perspective, they're now having to look at this as something that's more of an efficiency tool. It's not going to be direct reimbursement, and it's completely dismantling what they were thinking as they're building everything. And, Sean, I don't know about you. I'm not very familiar from the cost side of things, what these companies are putting in. But I do know when I've been approached by people that want me to sign up for their product, they're going to say to me, an individual person, that it would be 20 grand for an entire year to use their particular product for like research and things like that.
Yeah. The AI is very expensive. Like for me, I equate AI right now to like when the big screen TVs first came out.
Mhm.
Okay. Like
Plasma.
20 years ago.
Don't
And
drop it. Don't lay it
yeah,
on its side.
and it was the pixelated screens, and oh my God. And they were $10,000 or 15 or $20,000. I think it's the same thing as people like Elon Musk, who's already the richest man in the world. As he gets into AI more and more, and the United States hopefully becomes the world leader in AI through XAI, I think you'll see the costs starting to be driven down. But I still think, prior to people running out and spending money, I don't care if it's $1 or if it's $100,000, you got to vet the program. You've got to understand what the AI companies that you're about to purchase a service from or engage with as a business associate, understand what steps they have taken specifically to mitigate risks, not only for themselves as a company, but for the end user in the healthcare space. Because believe it or not, a provider submitting claims that they don't know are false to an insurance company, and they're relying on an AI program, they're not immune from prosecution under the False Claims Act. I mean, take a look at what the legislation being crafted right now entails. I mean, I never thought I would be back spending time with members of Congress like I was back in the late 90s, early 2000s. But again, I'm back involved at a rate that I really didn't want to be and didn't expect to be. But it's pretty neat because I'm getting an opportunity to experience new and emerging technology. The thing that I would say is, to the companies that are out there, like the one that you're working with, and hopefully they're going to listen to this podcast. I think there are things that they can do to mitigate the risks specifically in healthcare. I think if you're going to be an AI company in the healthcare space, you should only focus and function in the healthcare space until you get it perfected. But we know the rules and regulations are always changing. But I think there's things that they can do. Like they have things called retrieval augmented generation. I think they call it RAG. of all things, right? And it's an integrated AI model that has reliable databases such as vetted medical resources, right? Like the Centers for Medicare or Medicaid Services, the Medicare Program Integrity Manual, the Benefit Program Manual, Medicaid manuals for the various states, TRICARE, the VA, because this enables them to access accurate information in real time, and it ultimately reduces the hallucinations that we were talking about before. I think they need to be they need to be able to explain their AI models, right? So when I talk about being able to explain an AI model, I'm talking about developing transparent AI models to allow developers and users to understand the rationale behind the AI's outputs. Facilitating the identification and correction of, again, hallucinations. I think they need to be smart, and they need to create restraints to limit the outcomes, because as we talked about before, this is how we minimize irrelevant outputs and reduce the likelihood of discrimination. They need to put filters onto what's being created as an output, right? So if you're implementing automated or manual monitoring to flag or to block inaccurate or unreliable responses before they reach the user, well, again, this helps mitigate the risk of errors, discriminatory information, hallucinations. But to me, I think the most important thing, and I know I'm talking probably more than I should, I think they really, these AI companies, they need to be smart, okay? And they need to have human oversight and verification, right? I've seen terms like human in the loop systems, okay? Basically where, you're integrating the human experts like yourself as a coding and billing and compliance expert to review and validate the AI outputs, especially in critical healthcare applications. It provides an added layer of verification and reduces the risks of errors. I'll give you a great example. I was in a pinch, and I needed to write an expert report for a case about 3 months ago. And this was my big opportunity to prove myself wrong on how good AI is. So I sat down and I constructed about 3 paragraphs of what I needed. And I needed it to do deep thinking, right? Not just extra thinking, but what they call deep research or deep thinking. And it took the AI program about 18 minutes to put together what I needed, but it spit out a report. And my reports typically run, and you know this from working with me for years, my reports can run anywhere from 40 to 80, 90 pages, right? Mm-hmm. This spit out about 160 pages. Wow. And I gave it to poor Stacy St. Pierre. And I said, I need you to validate all of these sourced links. I don't care about the content, because I will go back in and I will take the content that it provided me and I will use that to drive my thought process, and I will rewrite it in my own words. Because as you know, you can reverse engineer AI. You actually showed me or told me about programs where you can literally take something that somebody has produced, copy it, put it into an AI program, and it will tell you to a certain degree of accuracy where it came from or whether it was produced by AI.
A percentage.
So, percentage.
And it highlights the sections that appear to be AI.
Yeah. So for me, as somebody who sits in courtrooms all the time, like I did last week, I mean, it paralyzes me with fear. But, I gave it to Stacy and I said, do me a favor, take a look at all of these citations. She called me after about an hour and a half of going through citations, and she went through about 15 or 20 of them, if memory serves correct. I may be wrong, but I think it was 15 to 20. She said, Sean, every single citation was wrong. every link that it
I
gave
thought
us.
you were going to say right.
No, every link that it gave to the Code of Federal Regulations 42 CFR, it gave like 414.64 and it should have been 75, or it was way off. I mean, things were way off. Now, simple things like, hey, Chapter 8 of the Medicare Program Integrity Manual, Section 8.4.1.2, where it talks about engagement of a statistical expert. Well, it got that one right because you can't screw that one up.
Yeah. Yeah.
So, I'm talking a lot, but there's two other points that I'd make, and then I know we have some other stuff to talk about. I think again, regular testing and auditing has to be a part of the compliance program for any AI learning machine, any AI company, because the continuous monitoring and evaluating of the AI models with pre-deployment testing and periodic audits helps identify and address potential issues before they impact real world applications, right? I mean, it's like what we talk about in compliance all the time. I think it's step 6 of 7 in the compliance program, auditing and monitoring.
Yeah.
But the last point that I'd make here on these AI companies is this. They have a responsibility to their customer base, to the end users of their product, to create a culture of compliance within their organization. And I think one of the things, that I am pressing Congress people, that I am engaged in conversations, those on the House Ways and Means Committee and those that are on the technology committees. One of the things that I am really pressing hard, and I'm hoping the new Inspector General for the Department of Health and Human Services, OIG, will really take us up on this, is the requirement for AI companies to build a corporate compliance program specific to the healthcare industry to ensure that they are not promoting fraud, waste, or abuse when it comes to the output of their information to the end user. I think they have not only a moral obligation, but they have a legal obligation to ensure that what they are putting out is accurate. And these little disclaimers that says, this is produced by AI, so it may not be correct. Well, that's like a doctor saying this note was dictated but not read.
Yeah.
I mean, it's the same thing to me, and I think that's a bunch of crap.
Yeah.
So,
well, and I thought it was a positive, this current client I'm working with, that they even are thinking about this before, because unfortunately what's happening is a lot of times they're reaching out after the fact. So it's a step in the right direction, but there's a lot of work that has to be done. And one of the other ways that I've been heavily involved in AI development is actually with a mutual client of ours, and they have their own EMR system. So they have their own team of developers, absolutely amazing, smart individuals. And what's interesting, the approach that we're having to take to ensure all areas are watched and met, we have multiple developers on the team. We have a clinician, so there's a nurse practitioner who does clinical quality control. We have internal counsel, myself, and others that are involved, and we're meeting on a regular basis with every single step that AI, and not all of it is straight AI. Some of it's just, their other, I'm going to say, regular development. I'm not a tech person, if you couldn't tell, but they're pausing at every moment, and we're saying, okay, well, this is what we want it to be. How can you get there? What is it going to disrupt? Is it legal? Is it providing too much direction to a provider where they don't have enough autonomy? And with this particular one, it is related to leveling of E&M, but one of the things that I'm interested to see what the outcome's going to be in about a year or two is related to these hospital systems and large outpatient practices that are now completely laying off their entire revenue and coding teams, sending it over typically to India and saying, this company sold us, they have an AI product, and then their offshore coders are going to review it.
I think it's such a huge mistake. I'll back up just a moment.
Mm-hmm.
What you're doing with the mutual client that you're talking about, that's the human in the loop, right? That's the human interaction. You guys are relying on clinical experts. You're relying on coding and billing and regulatory experts to be able to develop a program that, is learning. It's correcting itself based on the human interaction of auditing and monitoring and validating the output, looking for hallucinations, correcting those hallucinations, or the discriminatory output that it's providing to be able to limit the data sets or to be able to reconfigure the data sets.
And really quick, provider behavior, because there's a lot of times that they are getting frustrated, and I've seen this with other clients of mine.
Yeah.
They're frustrated with the EMR system and what it takes.
Yeah.
So they try to circumvent, and then we get really bad documentation. So that's
100%.
another part of monitoring is provider behavior.
Yeah, 100%. I mean, you can't audit and monitor an AI program in healthcare. And this is where I think if PE companies are listening to us that are trying to get into the space, it doesn't matter what your source code writers are telling you until you have resident experts in the specific areas of coding, billing, clinical documentation requirements, clinical output measurements, things of that nature, diagnostic measurements, tools, whatever it is. You can't give a level of comfortability to those of us that have been working in this industry for decades, who understand the ins and outs of regulatory compliance. It's just not going to happen. And I have, and I will continue to call out companies that are full of crap. It's just the right thing to do, because my job is to advocate, just like your job is to advocate for providers, to advocate for our clients, which are hospitals, health systems, DME companies, providers, whoever it may be. Even if it's a PE company and they're doing things the right way, we'll advocate for you, but you got to do things the right way. And you guys are doing it right, it sounds like, and I can't wait to see and hear what you guys have in the next couple of years. I still think ultimately we're 3 to 5 years away, but with what you said, you're excited to see what the next 1 to 2 years brings. Doesn't mean that your program is going to be ready in 2 years, but over the next 1 to 2 years, you'll test, you'll identify, you'll, correct, you'll mitigate, you'll move on, and you'll find the next set of potential hiccups. So it's exciting to see what the future holds. I just think the future is 3 to 5 years away.
Yeah. Well, and I think it's helpful to talk about these things because when we think about, coders or auditors, there's a lot of talk in the industry, oh, they're going to take our jobs away. AI is taking our job away. Yes, we are seeing that happening right now, but I think an outcome is going to be very similar to what we saw in the billing industry with revenue cycle management, where it was offshored, cheaper money, and then it's all coming back on shore, completely tangled, a mess, lost revenue. Now you have to pay to fix it, and you still have to pay the other rates. So, that's the thing. We can't tell people this enough for it to stop it from happening, right?
Yeah.
It's going to happen. Even just with the evolution of, credentialing bodies who are allowing offshore credentialing and things like that in the industry, it's opening that door. It's going to happen, but it's going to be coming back eventually because there's a lot of things as you've said, even if we think about critical thinking and all of the different nuances of our health industry, the laws, the regulations, that's not widely known and it doesn't widely exist in other areas. So it has to be a combined approach, and I think that's why I'm feeling so comfortable with it. Obviously, I'm neck deep in it right now with different developers, so it's helping me feel comfortable. But I
Yep.
can confidently say that these things being built are being built for typically efficiency and quality and things like that. Outside of radiology, that's just amazing what they're able to do with the
Yeah.
accuracy and pinpointing things prior to it worsening, maybe even a year or so before they can
Yeah.
see that with the eye. So, that type of thing is amazing. But outside of radiology, I'm really seeing this more as that tool component where it's going to help. And, from like a hospital facility standpoint, it needs to be looked at as a shift in job responsibilities,
Yeah.
maybe.
But
Maybe it can help with turnover or staffing, things like that. But not necessarily saying, oh, now all of our coders are gone.
yeah, listen, you're using the right term, Stephanie, and it's the term that I used at the very beginning. AI is a tool. It
Mhm.
is a tool that requires human interaction, intervention at multiple points, both at the front end, at the back end, and at points in between through an auditing and monitoring process. And this is one of the reasons why I believe that, AI companies working in healthcare, pushing out a healthcare centric product should be held to the same standards as a physician or a hospital or a laboratory under a corporate compliance program. And I really think that there needs to be the building of a corporate compliance program for artificial intelligence organizations. I think the OIG in the next year or two may start to look at their because they haven't really updated the OIG guidance documents from 2000 or 2001
Yeah.
at all. And we finally said, well, there's an eighth element, which is the risk assessment, right? But I think they need to add a ninth element, and that's the use of artificial intelligence.
Mhm. Well, and to finish us out here, Sean, can you
Yeah,
speak a little bit to, what entities can do because we are in the unknown? I
yeah.
was just reading one of the releases from CMS in April, and they're pretty much just continuing to shove it off. So where can people start to look, or what can they do to start to feel more comfortable from the regulatory side?
Yeah, I mean, that's a great question. I think, I think once some of the things going on right now within the Trump administration, the tariff war between China and the US and, the US and Mexico, and, you know, they get control of the riots out in California, and they get control of some of these other things going on around the world, Iran and things. I think you're going to see Congress really start to focus on AI, especially when you have a figure like Elon Musk really spearheading this with the heads of Larry Ellison from Oracle and SoftBank and all of these others that are getting involved. I think I know that I am going to be staying on top of this regulatory stuff. So I hope people will continue to read my blogs and hang out with you and me on the compliance roundtable when we do these on Mondays, and follow you on your auditing antics podcast. And because again, like you said, you're neck deep into stuff. I think it comes down to what I always say: find that circle of trusted resources like the Christine Halls, the Terry Fletchers, the Stephanie Allards of the world, and focus on what they're doing. Read what they're putting out. And it's not just you guys looking and seeing something and going, oh, I think I'm going to write an article about it. It's like I'm neck deep in this stuff, so I know intimately what's going on. And I think that's what folks need to rely on, are subject matter experts like yourself and those who are emerging experts in the area of AI, in order to be up to date and up to speed with where things are headed. But AI is here. It's not going anywhere for the foreseeable future. So I think it's going to come down to people, getting comfortable with it, but also recognizing, don't cut corners and think that just like you did for revenue cycle management, where you offshored everything and you got away from human interaction here in real time, that you're going to be able to do the same thing with AI. I think it will be an unmitigated disaster if people were relying on AI to do the coding to any high degree of certainty without human interaction. It's just going to be a big problem. And I think this will become an emerging area of focus for the Office of Inspector General, for the Centers for Medicare and Medicaid Services, and for the Department of Justice.
Yeah. And I think it's important too for everybody to realize that this is that territory where we're looking to best practices. There's a lot of times when we're doing audits and we come back and, even show the False Claims Act, and they don't want to look at that.
Yeah.
We're not going to be able to come to you with black and white guidance on a lot of these things. So like Sean said, you're going to have to continue to watch, but it's not going to also be do nothing, because then there's going to be issues in the end as well. So, all right. Well, I thank you, Sean. This was a great conversation. I knew you'd be perfect for this one. There's been a lot going on in this space, and it just continues to grow. So I thank you for joining. And I hope everybody has a good rest of your day. We'll be back next week. And Michelle will join us again in the studio next week. Thank you, Sean.
Thanks for having me, Stephanie. And I hope you all have a great day.